A virus is described as a submicroscopic parasitable agent consisting of nucleic acid surrounded by a protein coat. In this infographic video, we'll learn about a specific virus called HIV. The disease triggered by this virus is called AIDS. My name is Alphany Bethel, and I will be your presenter today. In 1947, Francois Barsanini discovered the virus when a patient had swollen lymph nodes. However, this virus is believed to have originated in Africa by consuming HIV-infected bushmeat and later transmitted through the sex trade. Is a virus similar to HIV, however, this is only present in animals. Because viruses can sometimes be present in humans and not animals, we can inject the HIV-1 genus lentivirus into the organism. Infections won't be detectable. Hence, they can be used to explore the effects of viral growth and disease treatment. HIV, also known as human immunodeficiency virus, affects the immune system of the infected individual. HIV causes a disease called AIDS, acquired immunodeficiency syndrome. HIV can live in your body for an optimal period of 10 years. Bacteria in the body develop an infection site. The body reacts by activation of the white blood cells. These cells carry out two forms of defense, releasing chemical signals at the site of infection, notifying other defensive cells, releasing signals that cause the helper T cells to duplicate. Over the span of these years, your helper T cells are fighting a losing battle as the virus replicate each other whilst destroying the cell. HIV is described as a retrovirus, which is spread by the dendritic cells, infecting the Th lymphocytes. The retrovirus duplicates by a form of reproduction bacteria use by attaching to a cell and obtaining their plasma membrane as their coat. The R0 for HIV is 2 to 5, which is relatively low due to the fact that this is primarily a sexually transmitted infection. After the budding process, the white blood cells remain in the body. After the budding process, little to no white blood cells remain in the body. This environment is perfect for opportunistic infections. Common opportunistic infections are meningitis, inflammation of the layer of tissue on your brain, and pneumonia and tuberculosis. HIV-infected individuals are never hospitalized due to the virus. However, because of opportunistic infections such as tuberculosis and pneumonia, treatment times may vary. Tuberculosis has an extensive 6 to 9 months period of treatment, whilst pneumonia has a 3-week period of oral medication. How can you contact the virus? The virus is transmitted through body fluids, through unprotected anal or vaginal sex, pregnancy and childbirth, drug injection needles, and contaminated body fluids. There is no vaccination for HIV. The safest way to protect How to know if you have HIV? Get tested. There are 2 types of testing methods, Western blotting and ELISA. Western blotting method is used to identify antibodies in the patient's serum. is used in AIDS testing, to detect the presence of antibodies against human immunodeficiency virus. A prevention plan was created on the advice of the CDC and local healthcare professionals. And the consumption of PrEP, and CDC also recommends that gay or bisexual males get tested 3 to 6 months. Treatment plans. Take your medication. They often contain inhibitors, which are used to control the growth of bacteria. Heart. Highly active antiretroviral therapy slows down the virus to enable your immune system to fight off the infections. According to the Center for Disease Control, during 1980 and 1990s, there were a total of 100,777 deaths among persons with acquired immunodeficiency virus. In Guatemala, there are about individuals living with HIV not receiving treatment and no viral suppressants. According to HIV.org, globally there were 37.6 million infected persons in the year 2020. Of these, 35.9 million were adults and 1.7 million were children aged 15 and older. A survey was conducted. The purpose for the survey was to understand the relationship between sexually active individuals and unawareness of HIV and how to prevent the disease. 62.5% were mainly 18 through 25 years old. 84.4% had a sexual partner between 1 and 5. 40.6% never used protection, 25% used protection sometimes, and 34.4% used protection no time. When asked if they have attended free testing, many said no because they never knew about it or they felt no need to. In conclusion, I believe making information about free testing and PrEP more accessible via social media can help with the knowledge of prevention of this HIV virus and pandemic.